Okay, you might ask yourself why we are in the waxing department now, but the answer is very simple, coming from a glazing. You see, these crowns now, since they have been glazed, in the inside coping, the metal has oxidized. You can see the oxidation, and you can also notice that besides oxidizing, some of the glaze appearance is inside the coping. So the inside coping needs to be sandblasted. But if we dare sandblast this without protecting our ceramic, what will happen? That sandblast might attack the glazed surface. So what we want to do with some wax, we want to protect all around the margin, and then we will sandblast. Then we will clean the wax off by using our we clean it by steam. So you see, at this point, I sit down, and all I do, I take my hot spatula and pass it around. Now, somebody might tell me, but why don't you polish also that metal spot you have there that was used to hold your crown with your tweezers while you were working and stacking your ceramic or putting your opaque on it? Well, the answer is easy, because in the glazing process, what has happened is that, okay, here we can see the wax around the border. So when I will sandblast, there will be no problems. The glaze now is isolating that metal in the patient's mouth, so it will not keep oxidizing once it's in the mouth. So for some appearance, it might look nice to have it all bright and shiny, that little spot, but then it might get attacked by the acid of the saliva and start an oxidation process that can corrode the inside coping in time. So this is the main reason why I do not like to polish and shine up, especially on bridges. Because if you have a connector, you might have an electrolytic. So you see, this takes only a few seconds to get done. We have done 3 of them, and now we can proceed with the sandblasting of the inside of the coping. Okay, so my crowns now are inside my sandblaster. I prepare to put my gloves on and turn on my suction, and you see now I can sandblast the inside without having to fear that the sandblaster will attack my glaze, the effort I made to have my glazing done. So this is one step further that I take the job, and this is very important for the gingiva of the patient, because if there's porosity in that area, it will be easy for other agents to attack the ceramic. And this is one step that many labs do not take care of. I mean, they sandblast these crowns without protecting the margin of their crowns. They just go on and sandblast. And while they're doing that, they're attacking the glaze they've done before, and the patient will have seated in his mouth. At the end, the patient will have seated in his mouth a crown which is porosity on the edges, and other agents will be attacking it. So you made so much effort at the end to just not get things right just for one step missing. Now here I am ready to steam the wax off, and proceed with checking my crowns. Okay, so here are my crowns. The margins, they have been sandblasted, and the margins are protected with wax. All I have to do now is just steam off that wax, clean them up. That's about it. And then we'll air blow dry them. There we are. Okay, that's it. Back at my grinding and porcelain bench now, and all I will do, nothing special, but let me set, okay, but at this point I will do, I air blow dry, that's it, and seat them. And seat my pieces. Okay. What I will do is I will check again color. I do make sure that my color matches. And we had a B3 here. I would say that's very close. And we had an A2, A3 on this other one. It was A3 down on the cervical level. I would say that's very good. I would like to give a closer look to all this, and it's a shame that I can't get these crowns really. I just can't get them, to show you. They would need pics, but if you connect to that link that I have wrote on my homepage on YouTube, you will be able then to link up and see some of my work. So this tomorrow morning will be put in its bags. We have certain bags for them, and will be brought to the dental office and into the patient's mouth. So I hope you enjoy to see this last procedure, and we will see more videos with Edident Lab.